guys, welcome back to Medical Coding with Blue. Today's episode is all about, are you considering a career in medical billing and coding? Here are some things you should know. If you are brand new to my channel, welcome. I am Blue, I'm a medical coder. Okay guys, I often get messages from stay-at-home parents that are asking, well, Blue, I've just been spending the past few years raising my kids. I have no background in medical, but I'm really interested in pursuing a career in medical billing and coding. Can I do this without having previous medical experience? Absolutely. There's many of us that do this. And this field is made up of a lot of different people from a lot of different industries. We have some that are nurses, some that used to be cooks, some that used to be cashiers, some that used to be babysitters, some that used to be stay-at-home parents. And so there's a lot of different people that get into this industry. And it takes a lot of persistence. So if you are somebody who gives up easily, or you are very impatient when it comes to getting your way, you want it and you want it now, this is not the field for that, guys. Because it takes, number one, it takes a while to learn it. It takes 9 months, 12 months, or 18 months. Some people get roped into these programs that are less than 6 months, and less than 6 months programs are really kind of setting you up to fail because it's so fast. There's so much information that is trying to be covered in such a short amount of time that it does one of two things to the person. It either helps them to learn to pass the test, but doesn't help them to critically think, or it just completely runs the person off from medical coding altogether. But unfortunately, you lose your money because these schools are not in the business of giving money back to people who change their mind because it wasn't what they thought. It is a very academically intense field to get into medical coding. And the reason that I say that is because you have to have really good reading comprehension. You have to understand a lot of rules, and rules that pertain to different things, right? There's rules that pertain to the ICD-10 CM codes, which are your diagnosis codes, CPT, current procedural terminology, HCPCS, ICD-10 PCS. And so each one of these things has their own set of rules, and they have their own set of guidelines. They have their own codes, the way that they're laid out and things like that. So with that said, you have to know a lot about a lot of things. You have to know your basics. You have to know medical terminology and anatomy. There's plenty of videos on my channel that cover how to learn medical terminology and anatomy. A lot of people try to skip that part. That is really just, again, it's a setup for failure if you try to skip that part. Because learning your medical terminology and your anatomy is going to make understanding the notes a lot easier. We've had this discussion in my Facebook group. Now, I don't like Facebook for like these Facebook medical coding groups. However, I had a bunch of people in my audience asking for this repeatedly. So I relented. There is a Facebook group for medical coding with Blue. So if you're interested in joining, by all means, go right ahead. But the thing that is on this group right now is a discussion about, studying and things like that. And when people miss certain things on a test, it is because they don't understand certain concepts. And I just kind of really just discussed that on the chat board here a little bit ago. But the thing about it is, guys, when I tell y'all that medical terminology and anatomy is very key and you have to know this, I'm not playing around, okay? When I tell y'all to read the coding guidelines or listen to the coding guidelines, again, not playing around, because a lot of these things can be solved quite easily by just following advice, So that's one thing that you have to know, that the studying is going to be a huge part of it. 9 months, 12 months, or 18 months. If you're in one of these short programs, it doesn't mean that you have to take the test right away, okay? If there's no time limit on your test, or maybe you get up to a year to take your test, then if you are in a short program, like 6 months, then stretch it out so that you study for a little bit more once you've completed your program, to kind of fill in some of the things that you didn't know. And you can learn these from books. You can learn medical coding from books. That's the other thing. The books that I recommend are in the description box below. Please do not ask me Do not ask me. I am so tired of getting that question. It's not funny because it's literally in the description box. I lay out the title and the author, and there's even the Amazon affiliate link. You do not have to click on the link. You can just look at the title and put it into wherever you find your books or wherever you buy your books at. And I've gone over these shows many times about, like, you know, what to do and how to work with your books and things like that. So take a look through the videos, guys. It's all there. It is literally all there. And research is such a huge part of what we do as medical coders. And that starts from the time you are a student. Okay? And again, there's going to be some things that maybe you don't understand and it doesn't quite make sense to you. But there's community out there. But you got to be very careful with this community. So again, I don't recommend Facebook medical coding groups, even though I have one. But I mean, it's the other ones that they're complaining or they're trying to scare people or they're trying to sell products. I don't do that, guys. Okay. I tell you all the truth. I'm not trying to sit here and sell you a school. I do have, you know, Patreon. I do have coaching and tutoring and, professional coaching and, resumes. I do have those things, but I'm not sitting here hawking that all the time. Okay. I do have it. It is there. Again, you can see it in the description box. But this is very self-motivated. You have to be self-motivated to learn these things. But you may have to reach out and find a mentor or a tutor. There's LinkedIn that you can join for free. LinkedIn is a wonderful place to make connections as far as, like, you know, finding mentors who can help you for free or finding a tutor where you're going to have to spend a little bit of money. Now, it's worth it if you find a really good tutor because that tutor is working one-on-one with you, and everybody's rates are different because it's based on experience and based on what they know and their range of knowledge. And so that's just something to keep in mind. But the investment in that can really help you out if you really get stuck. Okay, that's just my advice there. The other thing that you need to know about getting into this career field is that it is not the easiest to get into. There's a lot of employers that are asking for 3 to 5 years of experience, but you can't let that stop you from applying because, number one, it's free to apply. If you arm yourself with a really good resume and a really good cover letter and not just copying the one that's out there floating on the internet, if you can do that and you can lay out all your skills on your resume, then you are more likely, and you're obviously applying and being proactive with applying, you're more likely to get called than the person who's only looking for entry-level positions. Every place that you go to and you start brand new, you are going to be entry-level. Every place, even veteran medical coders, when they start somewhere, this is an entry-level person, okay? They're just starting in this type of clinic or this type of setting. And so everybody is new at one point or another. Everybody goes through the phase of, okay, you get your 90 days to ramp up. And ramp up, because I always get asked this question, ramp up means that you start and then you start building your speed, because it's not just the coding that you're doing when you get there. You're also having to learn an electronic health record. Now, these electronic health records are going to vary from place to place. And some places are still using paper. So you have to keep that in mind. Not everybody uses sophisticated electronic health records. Some use very sophisticated electronic health records, and others use a very cheap electronic health record, which you can tell because it's not intuitive. But that's another show for another time. But that's some things you have to know. You have to be persistent when you're out there applying. I have done plenty of shows about tips for your resumes. I've said it many times. Don't put on there that you're a team player, that you're organized on your skills list, because your skills is for your hard skills. It's not for your soft skills. Being a team player and being organized is a soft skill. Okay, guys, everybody is. But when you are applying, what are you applying for? Your resume should have an objective statement. Don't argue with me because I am a resume writer, so I have experience in this. And when I see resumes out there that don't have any kind of direction, you just kind of have everything like out there, what are you applying for? What is this resume for? You have to be able to update it per that job that you're applying for. So if it is for a medical records technician, you need to put on there that you're seeking a medical records technician position. You don't want to let it just be like with no direction, because these resumes often get printed out to give to the hiring manager. The hiring manager is going to have plenty of different positions that are available in their facility oftentimes, and it's not just for coders, it could be for other things as well. So what are you looking for? So if you don't want your resume to end up in the trash can, you need to be very direct and very specific about your purpose of why you are trying to get their attention. And another thing, if your resume needs to be on one page. Max, it should be 2 pages, but typically you want it to be on 1 page. As a resume writer, I've done 1 and 2 page resumes. Now I just do 1 page resumes because, number one, it's a lot cleaner, and there's a lot more that, a lot more you can do with it when you can get it down to 1 page. Please don't be like these people with 3 or 4 or 5 page resumes, because that's exactly the reason that you're not getting called. And somebody may say, well, Blue, no, I had that and I got, okay, whatever. But I'm telling you now, that does not happen for the vast majority of folks. They want very quick and to the point, because if you don't get this manager's attention in the 10 seconds that they are looking at your resume, you're as good as not called, okay? So again, look through my videos for those tips about your resumes, because your resume is important. That is your mouthpiece for when you are out there and you're applying, okay? Complaining about, oh, I put in over 100 resumes and no one's calling me and please help me, that is not going to do you any good. And especially if you start complaining about like that on LinkedIn, that is the worst place to do it. I have had to block a couple of people for doing that, because they just want to whine and complain. And when people try to help them and give them advice on what they can do to better their odds of getting hired, they don't want to hear it. It's easier to complain, right? It's easier to be able to say, oh, well, no one wants to hire me because I'm brand new, or I have a CPCA, or, nobody wants to hire me because of that. So I need to collect all these other credentials because somebody's putting that bug in their ear, right? That they need to have all these credentials. No. Another thing that you need to know when you're getting into this career field is that you just need 1 credential, at least for the first 2 years, because that way you can get your experience. You're not going to feel that pressure to have to collect all of these CEUs to be able to continually carry those credentials, because it's not just about paying for the credential, getting the credential, and then you're done. No, you have to be able to get the CEUs every cycle, which the cycle is 2 years. You have 2 years to get these CEUs. And for some of these credentials, you have to have specific CEUs from specific vendors who can charge you whatever they want to in order for you to meet the CEU requirement for that credential. So be smart. Be smart. Don't be like these people who have a plethora of credentials, no experience to back it up, and then they're out there upset and telling the whole world how, oh, they still can't get a job, and yet they're still lined up for another credential exam. Does this make sense to you? So that's another thing. Just keep your credential to 1 for the beginning, and stick with one of the main 4. Okay, the main 4 that employers are asking for is the CCS, that is the gold standard of medical coding credentials, the CCA, the Certified Coding Associate, the CCSP, the Certified Coding Specialist Physician Based, or the CPC, the Certified Professional Coder. And the CPC is with AAPC. The first 3 that I said are with the American Health Information Management Association. Both associations are well known and well regarded in the industry, okay? There is not one that is better than the other. If you look at the job listings, employers are asking for one of these 4. You just need 1. You do not need 2. You only need 1, okay? At least for the first 2 years. Get your footing, get yourself in the door somewhere, and that way you can move on from there. If you're worried about the fact that, oh, I've been a stay-at-home parent and I haven't had any work experience over the last few years, don't worry about that, because technically you have been working. It's work to raise children. It is work to care for family members who are sick, or any of those things. It is work. If you did any volunteering for the church, maybe you did the Sunday school thing, and so that's something that you could put onto your resume as well. Because when you work for like a Sunday school, for the church, you still have to get a background check, right? They just don't let anybody willy-nilly get in the church and do these Sunday school things. So that's something that you could put there. And not only that, you protect the students' information. You're not out there willy-nilly saying, oh yes, this person's in my class and this person. No. So that's already showing that you know how to take care of information that's private. It's the same thing when you're at home and you're a stay-at-home parent. You still have to manage the budget. You're still a part of managing the money and the funds. It's the same thing if you're volunteering with the church and you collect the money and you put all the money together. That's still money handling experience. These are things that could go on your resume. Now, why is this important? Why is money handling important? Well, if you can't really get your foot in the door right away with coding, you can certainly try billing. This is just a suggestion. Do not comment, because you will get blocked. Do not comment that, why would I want to start off as a biller when I want to be a coder? Because I had some nasty person say that to me. Here's the thing, guys. If you don't want to start off in billing, then don't. By all means, don't do it, okay? But there are some people who are trying to get into coding, so they're trying other alternative positions. This is just an alternative. You don't have to go this way. So what they do is they apply for billing positions, which if you look at the billing job listings, oftentimes they're asking for a high school diploma or a GED. They're not even asking you to be certified as a medical coder. Well, guess what you have to do when you're processing claims as a medical biller? You're looking at codes. You're looking at codes, and the buck stops with you before it goes out to the insurance to be paid. So if you have that knowledge already of coding and you see a claim comes to you before and you start processing it and you see that there's no modifier, when you know there should be a modifier, that's when you can kick it back and say, hey, wait a second, there's supposed to be a modifier here. Before I submit this to the insurance, there's a modifier that needs to go here because of X, Y, and Z. And if you're still studying in your books, you're going to know that. You just saved that provider from having a denied claim or having a claim go out, get paid, and then, oh, sorry, that was the wrong code or the wrong procedure or the wrong modifier, and you owe us money now because we audited you and this is wrong. You as a biller stopped that from happening because you have your coding knowledge. So it's a great place to build your skill without having that pressure of oh, I got to start coding right away. It is possible to do that, but a lot of times what happens is when you start off as a brand new medical coder in coding, a lot of times people will get very nervous because they'll say, well, Blue, I just don't know because I only worked with the book and I only worked with such and such, and I don't know how to do all this and I feel scared and I don't know if I'm doing it right. Some people need to have that extra practice of looking at notes to see and then get into coding. And there's nothing wrong with that. That is actually a better way to build your career, okay? Because spending a little bit of time with the billing side and then you go off to the coding, well, guess what? Now you're bringing billing knowledge as a coder. And you could say, well, yes, I'm experienced with, insurance companies. I know the billing processes for government insurance or for commercial insurance. And that's going to make you look even more attractive. And that's even just having a few months of experience, because you can work as a biller for 6 months and then continue on with your job search, guys. Where you start is not where you have to stay. And this is where I think a lot of people kind of get hung up. Like, well, if I get started here in HCC, hierarchical condition category coding, this is just diagnosis coding. And a lot of people say, oh, that's perfect for me because I'm really good with diagnoses, but I wasn't good with procedure coding. Well, what happens when you do this? If you get an HCC, if you get into risk adjustment, they also call it risk adjustment coding, okay? if you get into this, make it a short stay, okay? Because what happens is a lot of people find themselves, they get bored because they're just doing the diagnosis coding. When you look at the job listings, and I've seen this more than once, where they say if your only experience has been in risk adjustment or HCC, we do not count this as experience. Because why? You are not using CPT, you are not using ICD-10 PCS, all right, or HCPCS. You are only using the diagnosis coding. And what happens is a lot of people lose their skill in CPT and ICD-10 PCS or HCPCS, and then they're out of luck. So again, take that experience with HCC and make it short, 6 months or less, right? At least this way you can get familiar with what the notes look like and what the electronic health record looks like, and in getting that experience with Epic or Cerner or eClinicalWorks or any of those things, that's again going to put more experience on your resume that is coding specific. So it's meant to help you guys. That's all it is. It's just meant to help you. Again, sometimes people get it fixated in their mind that this is what they think it is, or such and such told them about this and that kind of thing. And they find themselves very frustrated because it doesn't go the way that they think. Okay. So if you are stubborn, and because you need stubbornness to say, well, I put out 100+ resumes, I haven't gotten called yet, but it's because I haven't found my forever home yet. Okay. Or I've started in this position, it's not paying what I thought it would pay right away, but that's okay because I'm using this to build my skill and I can continue to look for other work. I don't have to stay here. It is always at will. You are at will when you are employed, okay? Unless you sign a contract, that's something that's different. But with that said, don't be scared if you've been a parent and you're thinking that no one will understand because, you've been raising your kids. This industry, health information, is dominated by women. So there's a lot of mothers that understand. When I started here at my forever home, everybody had little kids. Everybody had little kids. I don't know anything about all that, but everybody had little kids. And so they all understood when, they had to leave early or their kid got sick or something else or something or another. And so it's not as where they're not going to understand that you have this huge gap in your resume. Don't think of it as, oh, I didn't do anything. What else did you do? Because you didn't just do nothing all those years. You raised those kids. Okay. So you helped them. You kept track of their medical histories and, what they took and things like that, and their surgeries and things. You kept track of all of those things. That's worth something. So you do know some things, but you're just not recognizing that as something that you can get credit for. We need to normalize getting credit for parents who stay home and raise kids, okay? If you stayed home and raised kids, or you stayed home and you cared for a sick relative, that is work. And you need to put that in your resume because that's not nothing, okay? It's not nothing. If you volunteered with the church, that's putting your time towards something, okay? It doesn't necessarily have to be the church. It could be the Girl Scouts. It could be the Boy Scouts. It could be PTA and things like that. I've done resumes before, and guess what? I had one. She was a stay-at-home parent. I said, okay, I got that on there. I said, anything else you did? And she said, well, I was in the PTA. Does that count? I said, sure enough. And so I put that on there. And sure enough, that was the reason that she got the call, because they said, okay, well, here you outlined your organization skills and everything else that you did when you did your volunteer work with the PTA. I'm just saying. So with that said, everything counts. Everything counts, whatever you're doing, even if you had your own business. Some people think that, oh, well, I was doing my own business. I was cleaning houses. You think that's not important? It is very important. And what else does that show? It shows that, number one, you can keep people's homes secure and all of these things. You can be discreet about different situations that you have as a business owner. So that's something, again, that is very important for you to outline on your resume. That's not something that you should dismiss in yourself. It's not something that you should dismiss that you did. Okay, so with that said, you have to really believe in yourself when you are getting into this industry. And you're going to have people who will try to talk you out of it. You will have some people who will be naysayers, or they will think that they know and they don't know. Sometimes they're from the medical industry as well. You can't listen to those people, okay? If you really want this, if this is what you want to do, you have to go after it. But it's not going to be all these wonderful things like you think right away. You have to earn these things. And I'm going to say one more thing before I wrap it up. If you want to get into this because you want to immediately work at home, I will always recommend that you don't do that. Simply because when you are a brand new coder, you need at least a month to be around veteran medical coders. See, that's not very long. You need to have that camaraderie with other coders so that you can build your skill, because book coding and real world coding are two different things. And especially when you get into the electronic health record, you need that time. It doesn't matter your reason, because people will write me and say, well, you know, I used to be a doctor and now I want to work at home and blah, blah, blah. No. If this is what you want to do, I don't know every employer in the world, but this is the vast majority. And not only that, you want to be set up for success. And I'm just trying to help you get there. So with that said, I'm going to go ahead and wrap this one up. Thank you guys so much for joining me. If this video helped you, please like, subscribe, and share, and I'll see y'all next time. Bye.